As far as how I plan to continue to stay up to date on the latest and most current evidence and to continue my growth and development as a future clinician, I know that the ways I've done it in the past as a student, by being able to access the UK library and just type in on PubMed or anything like that through the UK library, having that direct access to information, that's going to change. And I know that being an APTA member, I'm constantly receiving these emails and newsletters and magazines informing me of the direction and some of the latest evidence that we've got going on in our field. And it's important, it's directly impacting me. So I definitely want to continue to be an APTA member. By being an APTA member, there's a lot of benefits to that, as I've already mentioned, getting those newsletters, those magazines, getting emails all the time, just constantly finding out what direction we're going in, what's changing, what's going on in the realm of physical therapy. That's one way I kind of just want to stay up to date with literature as new things come out and they get put into the APTA and things I can search up, keep up with it through that way. But also I want to select an area and a place of work that is going to be very supportive and assistive in me being an evidence-based clinician to ensure that I provide my patients with the best care possible. I want to provide each and every patient with optimal care, and in doing so, that requires me to look at the evidence. So I want to find a place that is going to grant me the access, assist me in paying for the access, or maybe even paying for me to have access to the literature to ensure that I can stay up to date on it. I've also considered becoming a CI at some point later on down the line. That way I can have a student come in as well and just kind of compare how things have compare and contrast how have things changed from the time I was a PT student to now. What are they being taught? What's the latest evidence saying on their end? And just trying to find things out through that as well. So there's just a variety of ways that I plan to keep up with the literature. I know that sometimes life can be very difficult, especially one day if I'm blessed to have a family and raise them. But I got to make time for it. Again, if I'm going to do something in life, I'm always going to do it to the fullest. I want to be the best that I possibly can be. And that's going to require me to stay up to date with the literature so I can provide my patients with optimal care. I'm going to have to make the time, set time aside each week to make sure that I'm looking at the literature, looking at the latest evidence as patients come in with unique diagnoses, looking at the latest to find out how can I treat this patient, provide them with optimal care, all those different ways though. So there's a variety of ways that I plan to continue to stay up to date with the current and latest evidence to ensure my patients are receiving optimal care.